People are getting quite nervous about the rise in COVID-19 cases across the UK. We heard from Jonathan Van Tem, one of the country's foremost doctors, talking about this just the other day. Real concerns about how fast these cases are rising. And so I looked at the numbers to try and work out, how worried we should be at the moment. Are there red lights flashing? And this is the chart that, a lot of people have been looking at and saying, well, this is very worrying indeed. Have a look at this line, these bars rather. They show you the number of new COVID-19 cases we're getting each day. And if you look over on the right-hand side, you can see it has risen quite a bit in the last few weeks. In fact, the last 3 days, up to around 3,000 cases a day. That's the highest that we've seen since the kind of period of intense pandemic back in kind of May. So clearly that is a cause for concern that those number of tests, number of cases are rising to such a high level. But here's the thing, period right now is quite different to the period we had before, and that's because of this. Something has changed. We are testing more. We're testing a lot more actually than we were before, a lot more than many other countries. And as you have more tests, that black line going up, I've just superimposed the two on top of each other, but as you have more tests happening, you are more likely to get more positive results. So really a better measure of the prevalence of the disease would adjust for that and show you the number of positive cases coming back per test, a positivity rate. And that's what I've done here. Basically got a different chart showing you that positivity rate. And look, it's a very different picture. Down from around, in that period, kind of April, May, 1 in every 3 tests was coming back positive, whereas now it's around 1%. Now, it is up a bit in the last few weeks, so clearly that is something that we need to be watching, but it's still only at around the kind of 1%, 1 point something percent, 1.2% or so. That's something to keep an eye on, because the minute you get up to kind of 3%, 5%, that's something epidemiologists are genuinely concerned about. But it's still relatively low. So not a flashing red light on this chart, which is probably a better way of measuring COVID-19 in the country. And not a flashing red light as well when you kind of take that line we showed you a moment ago. This is just cases. Again, this is a line of the bar chart I showed you before, going up quite a bit recently. When you compare that to deaths, and this, obviously, the number of people dying of disease is perhaps the most concerning of all of the statistics that we've covered over the past few decades in this country. But have a look at the relationship between these two lines. So early on in the pandemic, the number of deaths, that black line, was rising in lockstep with the number of cases. But have a look at what's happened more recently. The number of cases has gone up, but that black line, deaths, has remained very low. In fact, the number of deaths that we've seen recently is about the lowest it's been since the onset of the disease, kind of around 10, maybe 20 a day, but low double figures, numbers of deaths, higher than anyone would like, but nonetheless lower than they've been for quite some time. And it does look like there's been a kind of, the relationship between those two lines has broken down in a encouraging way. Now, is this just that we haven't yet seen, is there a lag? Often, people get COVID-19, it takes some time before they face having to go to hospital, and some people sadly die. So are we just seeing a kind of lag, and we will see an impact from this in the next few weeks? Well, that's quite possible, but it so happens that in many other countries around Europe, they saw rises in cases before the UK, so we kind of get a little sneak preview of what that lag might actually look like. And the kind of moderately encouraging thing is, in many of these countries there has been a rise in cases, but it hasn't necessarily converted to a big rise in deaths. So this is Belgium. So similar chart. In this case, it's cases per 100,000, deaths per 100,000, but over a kind of 7-day period, which is why those lines are a bit smoother. But the important thing is the relationship between them. And look at this again, the black line and the white line, so deaths and cases rising in lockstep, falling in lockstep, and recently cases rising but deaths remaining pretty low, and actually cases coming down in Belgium. In a day, next few days, it might well be that there is less prevalence of the disease per 100,000 of the population than there is in the UK. Yet we are imposing quarantine. There's some question marks perhaps about the logic of that, but here we go. Similar picture as well in France. So cases, look recently, cases rising very sharply, deaths very low indeed, and cases have been rising for a good month or so. In France, we haven't seen much of an increase in deaths. Again, something to keep an eye on, because there are some surgeons talking about increased admissions in hospitals, but nonetheless, so far, that hasn't converted to the kind of what we were seeing earlier on in the pandemic. Excuse me, a similar thing as well in Germany. Cases not rising as much, but nonetheless deaths much lower. And in the US, even though the pandemic has been very different in the US, much more intense, more people dying, at least in terms of kind of pure numbers. Look, cases, that white line still now above the deaths line, whereas you saw more deaths in the early points of this pandemic. So there is some encouraging news when you look deeper into the data at this relationship. And why is that happening? No one's entirely sure. You know, might it be because the viral load is lower at the moment, so people aren't getting as much of the disease? Might it be that we are getting better at treating the disease? Certainly there's some evidence for that people are surviving more in intensive care when they come down with this disease. So some encouraging news there, but in practice, no one really knows. It's one of the things about COVID-19, so many mysteries, which is why, you know, we just keep looking at the data and keep not fixing upon one answer and remaining relatively open to new explanations as they come along. And while there are no flashing red lights, clearly it's important to be vigilant about this, vigilant about the rise in cases, vigilant certainly about the rise in deaths if that does indeed happen, and vigilant too about series like this. This shows you a number of people in hospitals, and right now, again, no flashing red lights. There is not an increase really. There's a slight increase in the last few days, but nothing like a trend, you know, more like noise in admissions to hospital for COVID-19. And we need to keep an eye too on tests and the number of cases that are coming back positive, because it does look like it's going up. And here's where the one thing that I'm really quite concerned about over the course of the past few days, it's not just those overall numbers. It is the fact that there are signs that the testing system, which we were told was now, you know, world class, is creaking right now. There have been anecdotal stories I've heard from a few people in the last few days about them trying to get a test and not being able to do so. That's pretty worrying, given that we are seeing cases rising and people are going to be concerned about that. And you can't get the economy going again and have the disease being kind of commonplace throughout this country if you're not able to locate where it is and if you're not able to trust the testing system. And now we have official admission from one of the people in charge, Sarah Jane Marsh, that it's not really working very well right now. Can I please offer my heartfelt apologies to anyone who cannot get a COVID-19 test at present? All of our testing sites have capacity. It's our laboratory processing that's the critical pinch point. So, you know, an admission there that the labs aren't necessarily getting these tests processed as fast as they should, that they're having real problems right now. I find that really worrying, given that testing is going to be the absolute foundation for how the UK deals with this disease in the coming months, if it doesn't want to have to go back to nationwide or big lockdowns. So we'll be keeping an eye on that and how testing is going. We'll be keeping an eye on all of these statistics over the course of the next few weeks. So far, no flashing red lights, but also no cause for complacency.